How's it going, guys? My name is Chris. The purpose of this video is to give you some insight, perspective, and tools that you can use to help you better cope with a painful injury or just physical pain of any kind. If this is your first time to the channel, welcome. The mission of this channel is to provide people with the tools they need to thrive despite any health circumstance. So if that sounds like something that interests you, consider subscribing. Now, I approach pain from two perspectives. One as the patient, because unfortunately I had a severe accident where I had 2 herniated discs and a labral tear in my hip. I also approach it from a clinician, so I get to see both what it's like to be engrossed in chronic pain for a period of time, and then also what it's like to be the clinician who's treating people over a period of time. So I get to see people as a physical therapist and also as the patient. I have a great appreciation for pain because of this, because I've been in a lot of people's shoes. Maybe I don't know exactly what you're going through. Maybe I don't know what pain you have, what injury you have, but I know what it's like to be in pain and how draining that can be and how it just kind of sucks the life out of you. But I have some good news for you. The overwhelming majority of people who are injured for whatever reason, even things as serious as a car accident or other severe trauma, they get a lot better. But everybody varies in how long those kind of things take. So the number one thing I can offer you as a perspective is give it time. I know that a lot of people don't want to hear that because just like anything else in our lives, we want it now, right? We want to get it now and we want to get this done with and we want to move on with our lives. But nature doesn't always work on a same timeline that we do. And for us to heal, sometimes we have to heal in multiple different dimensions. So if you're recovering from an injury of any kind, or for whatever reason that you have physical pain, maybe even mental or spiritual pain as well, that goes along with that, we have to be able to give our bodies, our whole being, a chance to heal. And that takes time. It just takes time. There's no way around it. I encourage you to make sure that you're surrounding yourself with positive and supportive resources as much as possible. Find the people that lift you up. Make sure that you're getting treatment. If you've had a physical injury, see a physician, see a physical therapist, and get on a rehabilitative mode. And support yourself in other ways too. Find other things that help to reduce your pain, whether it's meditation, whether it's massage, whether it's other types of body work or acupuncture, or just all these different types of modalities that you can explore and will help you along your pathway to recovery. I think the people that are the most successful at recovering from an injury and getting out of pain are those that have a purpose set for returning to a function or something that they want to do in their daily life. So if you have something like, I want to be able to play with my grandchildren, or I want to be able to return to the sport, and you focus on that instead of focusing on the pain that you have right now, then those people tend to excel and they tend to get better the quickest. And that's what I notice over and over again in physical therapy. That's not to say that you shouldn't be present with what you're feeling by any means. I know that there's been a great deal of literature that's looked at how mindfulness meditation and just accepting that that's how it is right now helps us to progress along any type of condition, whatever it is, depression, anxiety, physical injury. We acknowledge the pain instead of shutting it out, because when we shut it out, it usually comes back at us stronger because we're denying that it's there. So accept that you have pain and then start making a plan, an active plan with solutions on how you're going to get to the next step to get better. So once you've started out on your healing journey, you're on that pathway to getting better, make sure that you have some of the supportive resources that you need as well. Sometimes that includes something like a mental health professional. Maybe you need to see a psychologist or a psychiatrist, somebody that's going to help you through this difficult time. And if a healthcare practitioner has prescribed you pain medications, I encourage you to take them as they prescribed, because sometimes we're so afraid to take them, and what happens is we get in this pain cycle, that pain begets pain, and you get in this dangerous cycle that just keeps on going. So take it as needed, as they have prescribed it for you, because remember, this is likely just going to be something for the short term. Of course, we're concerned about addiction and those things, but if you're someone that's aiming to get better and you don't like them anyway, it's highly unlikely that you're going to get addicted in the first place. It's also helpful to have somebody hold you accountable to the things that you need to do to get better. You know, whether it's exercise or cleaning up your diet or going to sessions with a psychologist or some of the other supportive resources we mentioned. When you have someone that's going to hold you accountable, they're going to help to keep you on track because you have that accountability to them. I hope this was helpful, guys. These are the kind of videos that I do. I want to empower people by giving them the tools that they need to thrive despite any health circumstance. So if those are the kind of videos that interest you, consider subscribing and hit the little bell so you don't miss any videos in the future. Thanks a lot and hope to see you soon.